Money matters. Help is there to help prevent financial toxicity. We couldn't do this without the generous support of Genentech and Pharmacyclics, and so we're very thankful to them for making this webinar possible through their grant support. At this time, I'm really excited to introduce the incredible speakers that we have today. Carly Bergher and Megan Karam, both are from the oncology financial counselors with OHSU Knight Cancer Institute in Oregon. Carly is a firm believer that knowledge is power, so that's pretty consistent with our motive here. And the best way to orient oneself to whatever journey lays ahead is to have that knowledge. Before joining OHSU, Carly worked as the sole professional oncology navigator at a rural community hospital in Hawaii. She's completed 3 extensive oncology navigation certification programs. Her greatest joy is sharing knowledge to help those touched by cancer successfully navigate what really is a labyrinth of cancer care. Megan believes that during treatment, the relief of stress tied to the financial toxicity is critical to a patient's healing and recovery. Before joining OHSU, Megan worked at several hospitals on the East Coast advocating for patients and assisting with the Affordable Care Act implementation. She's also worked for the Department of Health, Human Services and the Social Security Administration, so she has a lot of broad experience. She's a strong advocate for the patient population at OHSU and connects them to what resources are available. I'll now pass on the presentation to our speakers. We thank them for their time and their expertise on this important and complicated subject. So welcome to Money Matters. Help is there and here to prevent financial toxicity. Carly and Megan, take it away.
Thank you, Brian. This is Carly, and I just want to say that Megan and I are both very grateful to have had the privilege of meeting Brian when he was here in Portland, and we're very excited to be participating in the CLL Society's first ever webinar. So thank you for including us, and I think we're going to proceed with some polling questions at this point.
Yes, so hi everybody, this is Megan. I'm going to read the first polling question. It says, I worry about the medical bills related to my treatment. There are 5 different responses. A, strongly agree, B, agree, C, neutral, D, disagree, and E, strongly disagree. So if you please would take a second and let us know how you are feeling about this.
Okay, so as we're seeing, I'm hoping that you can also see these results. It looks like 50% of you strongly agree, 39% agree, 8% are neutral, 1% disagrees, and 2% strongly disagree.
So now we will go to polling question 2. As a result of having cancer, what is your main financial concern? And as you can see, there are four options: paying insurance premiums, your medical bills, prescription medications, or living costs. And then we'll hopefully see the results. Okay, that's not surprising. So prescription medications being the highest at 48%, then medical bills, obviously 31%, and then paying insurance premiums and living costs are pretty similar there. One more polling question for us. So the cost of treatment is an important factor in determining which therapy is chosen. And again, it's those 5 options, and please let us know which one you feel like you fit with.
Okay, so yes, the majority of people do agree that it's the cost of treatment is an important factor in determining which therapy is chosen. And that's really helping us and the CLL Society dial in, I think, what is of greatest concern to you. So this is Carly again, and I'm just going to take a moment to clarify the role, Megan's and my roles at OHSU. We both have comprehensive and broad knowledge that we share with patients. We are assigned to 2 of the over 200 clinics that are present at OHSU. I'm sorry for I got distracted for just a second. But we're wanting to share knowledge to help patients and caregivers be fully informed so that they can make fully informed decisions. We also help to encourage and promote self-advocacy, and we refer patients to outside resources and expert assistance within the area in which they need assistance because, as you know, the system is very fragmented and it is a labyrinth, and there's no way that one person can be an expert across the breadth of everything. So we also provide objective information and guidance to our patients. We are not allowed to tell them what our opinion is about anything. We're just can only lay out facts and help them understand the best way to evaluate the pathway forward. Our patients typically reside in Oregon and Washington, although we often have patients come to OHSU from across the United States and even internationally. But because of our location in Oregon, our knowledge is based on local resources available within Oregon and Washington. We are aware that many states offer the same resources, but they may actually be called by a different name. And also, we wanted to let you know that most cancer centers do have financial counselors and/or patient navigators, and they may be available to you in the format of professional capacity or a licensed social worker or nurse navigator. So we recommend you ask your treating oncologist or social worker to be connected with the appropriate resource at the center where you're being treated.
Okay, and we're going to do a polling question. We're just curious to know if you are currently connected with either a financial counselor or a navigator at your current cancer center. So yes, no, or I'm not sure if that even exists.
Wow, that's a surprising result for us, and I think I can speak for both of us when I say that I'm sorry to see that kind of a result. So we're going to move on to a topic that actually feeds into this question about activating your inner advocate.
So, you know, unfortunately, we don't really have a question up asking any of the participants where you are currently at in the process of your treatment, if you're newly diagnosed, if you've been at this for a while. But as all of you know, I'm sure that you know, knowledge is power, and it really does help reveal and determine your path forward. Wherever you are, whatever you're going through, it's just to breathe, stay present, and be engaged. Know that you're in the driver's seat of your care. You can really be the decision maker in anything that you are wanting to do, and just know that it's been clinically proven and shown that patients who do this move through the process more smoothly. Determining your care team is huge at first. Family and friends, who's in and who's not. Just forming your inner circle and knowing that the people that are around you are really supportive of you if you are struggling with whatever treatment you're currently in and you are able to have a caregiver or someone help you and take the bulk of things that you're just not able to do just because you don't feel well, just knowing that you have that support system can just make a huge difference. Support groups, just like the CLL Society, what they're doing is amazing and connecting people from across the United States. And then, of course, your medical team, so your doctor, nurse, and social worker. And hopefully everybody is aware now that there should be a financial counselor, patient navigator. This role is really, the role that we're in here is called so many different things within cancer centers across the United States that it might just be something that is called something different that you might haven't even been aware that exists. But hopefully now that you know there is a role like ours, you can go back when you're seen at your next appointment and can try and find that person to help you. Okay, so ask questions of your healthcare team. Ask questions to find resources to help with medical bills and other bills. I'm sure you are all well aware of the resources that are out there. I'm not sure if you've had experience soliciting it or having help enrolling into certain programs. And ask questions so you can focus on healing and regaining your health. Roadblocks will appear and many will be artificial. This is one that I know Carly and I really do experience daily with our patients. It just seems like everything happens at once. Our patients experience so many things while they're going through treatment. The loss of a job, the loss of an income, the loss of a spouse's income or job, sometimes housing. It's just, sometimes it can just feel like it's a giant setback. And just to be proactive to possibly prevent any setbacks that you could be in control of, like an insurance transition. And no doesn't always mean no. Sometimes we are helping patients and they've been told no so many times and just don't realize that there are ways that they can maneuver around whatever issue they're currently dealing with. Escalating issues up to higher levels of authority, just really pushing for yourself and advocating for yourself. And then again, if you're not able to have that support group or caregiver that can help you.
Yes, it's very important that you be supported in advocating for yourself. Part of this self-advocating has to do with what we've called casting your net. And so from my experience in Hawaii, where they do use throw nets for fishing, and in combination kind of with sailing, you know, you're looking ahead for possible navigation problems, like there's a storm brewing, or there's maybe a shipping container that's floating in the water. So you're always keeping your eyes kind of ahead and also 360 degrees so that you're making assessments as to any course changes that you need to make. And so the casting of the net means, like Megan said, being proactive and creating backup plans so that you are well supported and are not going to slip through a tiny crack or a hole in a net, but you have finer and finer nets underneath you until you're completely supported. And so we just wanted to discuss briefly some of the resources that we've had experience with. These include financial assistance. So for example, at OHSU, we do have a robust financial assistance program that is application-based, and the criteria for eligibility are based on household income and family size. We're also familiar with billing end options that include payment plans with no interest and prompt pay discounts. And these are things that you can inquire about wherever you are being treated. We're also familiar with medication assistance programs. Here at OHSU, we actually have a department that's called the Medication Assistance Program. These programs are based either on diagnosis or
Per medication.
yes, or per medication, and include an application process. They're often being provided directly from a pharmaceutical company, from the manufacturer, or from another nonprofit organization such as the Leukemia Lymphoma Society and PAN Foundation, or PANF. We're also aware of travel and lodging assistance. Sometimes patients' insurance will have a travel benefit associated with it. Organizations like the American Cancer Society may have available programs, and it's always good to check with your navigator and or social worker. And then finally, dialing 211 is a way to connect with local resources in your area to help with general living costs, things like utility assistance, rental assistance, etc.
And just to go back to medication assistance programs, normally these are something that would come up in conversation when you're coming up with a treatment plan with your physician. And you know, doctors don't know if you are struggling financially. Their job is to look at you clinically, medically, and offer you the best care, best medication or drug based on what's currently going on with you. So if they're not aware that you're out of pocket for any type of medication that you're on is crippling you, they might not let you know that, hey, there are medication assistance programs, and we do have nurse coordinators that help with that. Doctors, nurses, nurse coordinators, pharmacies, pharmacy technicians, they are usually very knowledge-based about medication assistance programs. So it's even something that you can talk about or ask about during an appointment. And traveling and lodging assistance, we have a really great managed care department here at OHSU that really help look at a cancer patient's insurance and check the benefits and see if there is traveling and lodging. And oftentimes we'll call and discuss that. And that is something that if you don't have that offered to you at your current cancer center, we really do think it's worthwhile to call your insurance and ask about travel and lodging if you haven't already. Just educate yourself about that part of your benefit and see if it's available.
Yes, and I'm going to concur with Megan. It's always, always good for you to establish a relationship with your insurance company because they are the ones who are providing you your medical benefits. And it may even be possible for you to ask to be assigned a case manager, and then you would just be dealing with that one person.
Mm-hmm. Okay. So we are going to move on to, there's a link at the bottom of this slide, and it is to triagecancer.org, which is a wonderful organization. We can't talk about it enough and how amazing it is. But if you use that link, it will take you to this link to their website that will show you the whole map. And you're able to click on the state that you're currently living in, getting treatment in, or if you're going to nearby states, you can click on those as well. But they will outline and show resources that are available in your current state and area.
Okay, everybody, fasten your seatbelts now because we're about to enter the maze of health insurance, and this is actually a great image of the maze, and then you can see that the person's pocket is being emptied of all of its money. So it is sad but true, and that's why we're having this webinar.
So we are going to ask you another polling question. This one is, do you feel like you have a good understanding of your benefits in relation to your current treatment plan? So 3 options, yes, no, and I'm not sure.
Oh, okay. Well, that's good, and hopefully through this webinar and your own connection with your insurance company, for those of you who are not feeling that certain about your benefits, you'll feel better after we're done here today. So we're going to dive in now to the various types of insurance. And I'm going to speak a little bit quickly because I do see that we're not halfway through our presentation, but we're close to that in time. So for insurance, there's group insurance, and this is what's most typically associated with insurance that you would receive from your employer. It's coverage that covers a defined group of people, and if the employer has at least 20 full-time employees, that an employee whose employment was going to come to an end would be eligible for COBRA transition, which we'll talk about later. There's also commercial insurance, which is insurance that is purchased directly from an insurance company. And then there is marketplace insurance, which resulted from the Affordable Care Act and is commonly named by people as Obamacare, but please don't call it that. It's the insurance marketplace. And this is a platform that offers insurance plans to individuals, families, or small businesses. And depending on income, premium tax credits and cost reductions may be possible. So at the bottom of the slide, you'll also see that we've listed, there's a link there for special enrollment periods for group, COBRA, marketplace, and Medicaid coverage, and that's on the marketplace platform, healthcare.gov, and we encourage you to take a look at that.
Okay, and so I don't know if many participants have had experience with the marketplace, but just know that there is a marketplace for every state. So here's just a link. The loading image is supposed to just be comical because when the marketplace first came out, it was kind of difficult to maneuver, but that's not the case anymore. So no matter what state you live in, you can enroll in affordable quality health coverage. The marketplace is an amazing resource to go to. You can go to healthcare.gov/marketplace in your state. The link is on this page. And people who have had experiences, we always recommend that you worked with a qualified marketplace health insurance agent. Unfortunately, Carly and I are not insurance agents. We cannot advise patients on which plan to enroll in. So we do want you to work with somebody qualified, as they can advise you on which plan is best for you.
So our next slide shows Medicaid coverage state by state, and there's a link there where you can find out more about Medicare in your state of residence. Not all of the states have expanded Medicaid, but you see that the majority of states have, and we can speak to Oregon that we actually have a very robust Medicaid program within the state of Oregon. And the other important thing for you to know is that generally speaking, someone who's coming from out of state who has Medicaid, their Medicaid is not going to authorize them, for example, if they're New York and they want to come to OHSU for treatment, generally speaking, Medicaid is not going to authorize them for services at OHSU. They need to remain within their state of residence. Can you think of anything else, Megan?
No. Yeah. Well, and then if you are currently on Medicaid and you will be moving to another state, normal practice before you can be approved for Medicaid in the state that you're moving to, you need to disenroll from the program where you were previously living and need to show proof of that before you can re-enroll. But normally re-enrollment is fairly quick, as long as nothing of your income or household is changed. Yeah, okay. So our next slide is talking about the pathways to Medicare. So there are two pathways. Parts A and B, Part D, prescription medication coverage, and a supplement or a Medigap plan. Those are kind of used interchangeable. And then Medicare Advantage plans. We just put an image here showing you how both of these are kind of broken down and how you have to, if you do choose enrolling in parts A and B, D and a supplement, it's normally not more difficult, just more time consuming for you to enroll in it, as with your Advantage plan, normally your D is included or looped up into it. And then we hear, we're gonna get to it in the next like slide or two, but we hear in the United States period, every state does have an assistance program to help those who are transitioning to Medicare. And this is just a link to our SHIBA program within Oregon, but we'll get into this in the next few slides. So this next one, we have a polling question for you. Did you know that every state has a dedicated program to assist with Medicare enrollment? So yes, no, or I'm not sure. Oh, wow. So like 50-50, kind of?
Yeah, so that looks about 50-50. And so this is another good thing then for those of you who were not aware. Within each state, there are health insurance assistance programs for Medicare eligible patients. And the national name is SHIP. And SHIP is a free health benefits counseling service for Medicare beneficiaries and their families or caregivers. And the mission is to educate, advocate, counsel, and empower people to make informed healthcare benefit decisions. So that follows along with what we said in the beginning. You as a patient being in the driver's seat need to be educated, need to advocate, and make informed decisions. So SHIP can help you do that when it comes to Medicare. It's a federally funded program. It's not affiliated with the insurance industry. Therefore, you're being provided again with objective information, and no one, for example, is profiting financially from your decision. These services are available free of charge. And then they often have ongoing workshops in your area based on county of residence. So you want to be sure to find out the name of the program in your area. Here in Oregon, we refer people to, the organization is called SHIBA, Senior Health Insurance Benefits Assistance. let's see, calendar listings of workshops. This is all that you can find on the website for your state. So you can go to the link at the bottom of the page and find the SHIP organization within your state.
Okay. So next, we're going to talk about Medicare savings programs, just because I feel like Carly and I have both had experience with patients being enrolled into this program and being unaware of it. So you can have Medicaid and Medicare coverage at the same time. Sometimes it's this thing that's talked about and people are saying no, that you can't. You absolutely can have both at the same time. You can get help from your state paying your Medicare premiums. In some cases, the MSPs, that's what they're normally called, may also pay your Part A and Part B deductibles, coinsurance, and some co-payments if you do meet certain conditions. So there are a few different programs listed in blue, and you do have to qualify for these programs just like you would have to for Medicaid. So it's based on your income, your household size, but it really does provide extra help for you, helping with your out-of-pocket expenses, that 20% that Medicare doesn't cover and just accrues. And it also qualifies you to automatically be enrolled for extra help for Medicare prescription drug coverage. And then we did put a link here at the bottom just for some additional information if you feel like you might qualify for it. If you have qualified for Medicaid in the past, it's definitely worth your time to look at it, look at enrolling in it if you are currently a Medicare patient. Yeah.
One other thought that I wanted to add is that regardless of how you have accessed Medicare, if it's you have original Medicare, which is A, B, Part D for prescriptions and a supplement, or if you have a Medicare Advantage plan, if you meet criteria, you're still eligible to enroll in a Medicare savings program, and it will help you in there's no difference between the way the program benefits you based on which type of Medicare you have.
Okay, so I've been told we have about 10 minutes left for the presentation, and we do have quite a bit left. So we're going to try as quickly and as carefully go through our next slide as we can. Our next one is talking about prescription resources, which we do realize was a huge thing everybody said that they were worried about at the beginning of this. So we have touched on medication assistance programs, patient assistance programs those are often used interchangeably. So like Carly had said before, most pharmaceutical companies do offer copay assistance. You can contact them directly to see if you qualify. You don't have to go through anybody in your clinic or hospital. Generally speaking, you do need to have commercial insurance, but not Medicare. And that's a guideline that we do pretty much see right across the board with these. One example we have for ibrutinib, there's the UNI support program, which I'm sure some of you have had experience with. There's the PANA for Pan Foundation Patient Assistance Network. This one is diagnosis-based and provides a certain amount of funding to help you for medical bills, copays, things like that. The Leukemia Lymphoma Society Copay Assistance Program is amazing. We have patients who enroll in this all the time. We did see a question about that and how to best go about being reimbursed with that. So hopefully we'll answer that later. And that one is also a diagnosis-based assistance program. Needymeds.org. Do you want to touch on that one?
So needymeds.org is it's almost like a clearinghouse of different programs it's actually really wonderful. And while they may not have a program for a treatment-specific medication, they do have a drug discount card in partnership with Triage Cancer. You also can find very common medications on there as another way to save money. If you're saving money on other expenses that you can divert to the cost of your high dollar medications, that is a useful strategy. I wanted to say one other thing about Leukemia Lymphoma Society, but it could apply actually to any of these funding sources that you're looking at. Funds open and close when they become fully allocated, and then often, like with Leukemia Lymphoma Society, it seems that they open and then they'll close again.
And they
reopen in a few weeks. So it's always good even to check back. And if you need to designate someone to do this for you, that's a really useful role that a family member who's looking to be helpful could take on for you. But you don't take it as a hard no. It's very likely that the fund will open again.
Right. Okay, and so we're going to go on to some tips about prescription resources. You can save money by price shopping different pharmacies. We have patients who do this all the time. We definitely recommend that you do that. Always ask for the cash price. We've had experience with patients who are going from, I don't know, I don't want to name pharmacies, but going from pharmacy A to pharmacy B, and they're saving $50, $75, you know, which doesn't seem like that much, but for as often as you are refilling those medications, it's a lot. During open enrollment or when searching for new coverage, be sure to check the plan's formulary to confirm that your medications are even on there and covered, which, yes, we do know is time consuming, and you are prescribed different medications all of the time, which leads to the next point. Our physicians here are pretty amazing in that based on your diagnosis, they can give you a formulary showing you any possible future medications they would foresee you may need, and then that's also really great to use to price shop plans and to see if those medications are covered as well. And then again, sometimes obtaining medications outside of your insurance is the most cost effective. I know Carly has had a few patients who have used Needy Meds or Good RX and haven't even really used their prescription coverage that much, and has been really successful with lowering their out-of-pocket.
Okay, so we're going to, in the interest of time, we're moving on. We have another polling question.
So I feel confident in my understanding of the different types of health insurance plans available. Agree.
Okay.
That's great. That's really great. That's really reassuring. Okay.
Okay, so our next slide actually has terminology on it related to different types of insurance plans. And in the interest of time, we're not going to go into this because this is something
really complex.
We feel like you can research it a bit on your own, but we do want to dive into benefits, insurance benefits. So to make sure that everybody understands, so the premium is what you pay monthly to maintain active insurance coverage. The deductible is the amount that you pay before health insurance starts to pay their share of the cost of your medical bills. And once claims accumulate to this amount, then insurance will begin to cover with co-insurance. So if your deductible is $150 and claims accumulate to $150, then insurance is going to start participating in the paying a cost of your expenses. Co-insurance is the percentage that you pay and your insurance pays. So if you're responsible for 20% after the deductible has been met, then insurance is going to pay 80%. A co-payment is something that you would pay, for example, for an office visit, and it's typically a set amount, like $25, and you pay at the time that you receive your care. And then the out-of-pocket maximum represents the most that you would have to pay in 1 year. It's generally based on a calendar year, but sometimes there are, like for employer-based group coverage, the coverage is based on a fiscal year. Yeah. And the out-of-pocket maximum does exclude the premium. Another important factor to consider or determine is whether or not your insurance is in network with your healthcare provider and or the facility where you're being treated. You typically pay less with an in-network provider than you do by going out of network. You can see on the slide that we've specified in-network you might pay 20% and insurance pay 80%. And out of network, you might pay 30 and insurance pay 70. So out of network represents providers and facilities who have not contracted with your insurance company. You may want to check with your health insurance plan to see if you are covered for out of network providers, because you may also have out of network benefits you can utilize.
Okay. And then our last slide is just showcasing, putting a visual out there for anyone who is transitioning to Medicare soon. It's showing the Medicare enrollment period, the 3 months before your 65th birthday, the month of your birthday, and then the 3 months after your birthday is what is called the initial enrollment period. So transitioning to Medicare, eligibility is determined by age or disability. You can absolutely be put on Medicare prior to age 65 if you've been found disabled by Social Security. And so by age, see the opposite chart. Again, we are linking a Medicare quick guide from Triage Cancer's organization. It's really great. I definitely recommend anybody who's transitioning soon to open that and filter that, read through that. And for more information, you can absolutely go to medicare.gov, or prior to our other slide, reach out to your state's SHIP program, which we couldn't talk. I mean, those programs are just so useful and helpful and provide unbiased information for you. Okay, so one more slide and then we're going to read through your questions.
So finally, everybody, Piglet noticed that even though he had a very small heart, it could hold a rather large amount of gratitude. This is something really important. I mean, first of all, we're so grateful for this opportunity to speak with everyone and to have collaborated with the CLL Society. But it's important for all of us, regardless of where we are in life and whatever adversity we're dealing with, to connect with feelings of gratitude every day, because it helps connect us to a purpose and it helps reduce our stress level. And life really is a dance, and we're just happy to have been here with you. And we're going to dive into some questions now.
I am going to tackle the question about, let me find it. Lou's question about LLS funding, just because I had this happen this past week. Billing departments within organizations are really convoluted, and sometimes you can't even meet with someone face-to-face in person. They don't often have very much experience with billing assistance programs at some facilities, unfortunately. It's kind of like that here I've had experience with. At my previous hospitals, They would handle patient assistance program billing beautifully, and you would never have to get involved. So I'm sorry that you're having to go through this. Yes, have others had this problem with it? Yes. The best solution that I've seen here at my facility is submitting it yourself. Yes, I had a patient who was not able to do it herself. I submitted it for her, and LLS is very quick to come back and either, deny or approve payment. So you can submit it yourself, and I think you actually have to be reimbursed. So you might have to pay for it if you do have the means for that, and then they would reimburse you. But if you're having issues with getting your facility to pay for it, I would recommend trying to get in touch with the billing department, sit down with somebody, ask for a supervisor, bring in the packet that you've received from LLS showing the sheet that you need to submit with the documentation showing what you need paid. Try that avenue first, because obviously that would be the easiest. But if you do need to pay and then have them reimburse you, if you do have the means for that, it's very quick. Yeah.
And I think I wanted the very first question. So,
This one?
yes, from Sheila. Heard there is no way for Medicare HMO patients to switch to Medicare and supplement insurance. Is this true? So this would actually be a really great question to direct to your local SHIP office. But what I can tell you is that it may be difficult to do that transition because the Medicare supplement has enrollment criteria of something called a guarantee issue. When you're first eligible for Medicare, you have a certain amount of time to enroll in one of these plans and be guaranteed issuance of a policy that they wouldn't be able to deny you coverage based on a pre-existing condition. The Medicare supplement is not a full insurance like group coverage or marketplace coverage. It only pays on services after Medicare pays. And because it's not full insurance, it's excluded from that criteria of not denying based on a pre-existing condition. So this would be something that would be very good to talk about with SHIP to see if there is some circumstance in your particular situation, Sheila, or anyone else who's wondering if they can switch to original Medicare, to find out if that is an option for you. These supplement companies have the option of either accepting you or denying you, not approving the enrollment.
Okay. Yeah. I'm going to answer Beverly Prelick's questions. If you get a doctor bill from, or I think if I got a doctor bill from the hospital for $400 and that was our fee, sorry if I'm misreading that. We have Medicare and a UHC AARP plan. They paid something, but not the $400. Do I owe that, or should I question it? You should question it. If it's something that doesn't look familiar or look right to you, you should absolutely call in, ask to speak to billing, and question it. We have had experience with patients being billed incorrectly, not being aware of it, paying the bill of $500. We run across it months later and they're not able to be refunded, or something can't be done to where everything that happened and the bill is paid can be adjusted. So yes, if it's not something that you feel like you owe or you have questions about it, there's nothing wrong with you calling in and questioning it. I highly support you do that.
And the other part of that is also that you refer to the statement that Medicare would send you, and that United Healthcare would send you based on sort of explanation of benefits, but I know that they're called something else in Medicare. The other thing is to be aware of what your Medicare supplement plan type is,
Right.
and whether or not it's paying your Part A and B deductibles, because that might represent a portion, like
Of
the
what you're having to
yes,
pay.
the 400 might include
Your Part B, which is like what, 175?
180, I think 180
I always forget
something.
that. but-
Yes.
Right. Okay.
Yeah, so let's see. This is from Irene Gruber. Hi, most of assistance is based on income and household numbers. What happens when your income is too high, but your medical and insurance costs are 20% or more of your income? That is a good question, Irene. And, you know, if you, depending on what kind of insurance you have, if that is COBRA insurance, that could create an opportunity for you to, like a special enrollment period for you to look at enrolling in marketplace coverage, because there is a cap on how much COBRA
Can be of your income.
yes, can the percentage of your gross income, and it's something like 11%, I believe. So if you are currently enrolled in a COBRA and your premium cost is 20% of your gross income, then you could go through the insurance marketplace. But not knowing what kind of insurance you have, otherwise the question is a little bit,
It's hard to
answer.
Oh, here she goes. It's not COBRA. It's from MNsure. I'm not sure what type of insurance that is.
Is MNsure Minnesota?
Minnesota
Sure. So in that case, if you have, are you saying, so if the premium cost is so high, but your income is high, or is it the out-of-pocket responsibility of the insurance that's high? You would want to look at billing end options, whether or not you would qualify for financial assistance. I'm not sure that we can actually answer your specific question in much detail, and I apologize for that.
Yeah. This is an anonymous one. I had blood work and network, but more testing was done. They sent it out of network to an out-of-network provider. You received an additional $1,000 bill after already paying $1,800 to a lab. All these tests were done in July, and do I need to pay? It would be interesting to know what type of testing was done and where it was sent. If it was some type of genetic test, I wish that people would inform patients that genetic testing is very sketchy. I mean, it's not sketchy, it's amazing, but meaning billing and out-of-pocket. Genetic testing is really hard to predict if an insurance company is going to cover that or not. So that $1,000 bill might be related to a test, like a genetic test that might not be covered by insurance, which is shocking when you see and you get a bill like that in the mail. I saw another question about calling, who to talk to when you do get bills like this. Hopefully on the statement that you got, there's a number that you can call and speak to. If you get someone on the phone that you don't feel like are giving you great information, I always recommend to ask to speak to the manager or supervisor.
And sometimes here, at least at OHSU, if this is a genetic testing lab, we often are contacted by the clinic related to these bills, and we do know that there is the potential for financial assistance because insurance often is not approving genetic testing. And the lab issue is kind of complicated because authorizations are typically not obtained in advance.
Yeah.
So that makes it really difficult for patients to obtain upfront information about what the cost will be. But again, you know, if you do wind up responsible for that amount, you could ask about a prompt pay discount or establishing a payment plan.
Hi, Dr. Kaufman here. I'm going to jump in because we're coming to the end, and I wanted to make sure I spent a minute thanking Carly and Megan. And obviously, we can't get to all the questions, but I'm very grateful, and I think Oregon Health and Science University is very lucky to have the two of you helping with patients. But as they pointed out, these resources are available in the community. As a Medicare patient myself, I went down to the Social Security office, got very good counseling about what to do, how to handle things. They were extremely helpful in terms of making the transition. There's things online. People have asked about what meds they should, you know, what meds are covered best in which Part D. And actually on the website, you can put in what meds they're on, and they will make a recommendation as to which Part D plan to buy. I used an agent to help me with that who was experienced in Medicare. It was, I'm not going to say it was easy, but it wasn't as painful as it had to be. It takes some work. You're not going to get you're going to have to put some effort and time into making that shift to Medicare, but it is definitely doable. And if you're in the pre-Medicare system, we just listed one of the drug plans, but if you go to our website, we have a whole list of all kinds of resources, including a link to Needy Meds and others, but all the pharmaceutical companies, you know, not just Pharmacyclics, but AbbVie and Genentech and Gilead and Veristem Oncology, and all the manufacturers have plans to help you if you're in the pre-Medicare area. So lots left to be done at a federal and state level to try to help people, but I'm hoping this got people started. These slides will be available within the next day or two on the website. And we'll send out a notice next Tuesday about exactly where to find them and how to link to them if you're getting our weekly alert. But again, I wanted to thank Carly and Megan for this amazing webinar, and thank Oregon Health and Science University for lending you to us for this hour. Thanks so much, and look forward. We'll have another webinar coming up in July on the emotional roller coaster that's CLL, and then we're planning another special one for veterans and one for end-of-life, hospice, palliative care issues and stuff too. So stay tuned and you'll be receiving more information. Thanks, everyone.
Thank you so much. I hope that some of you were able to gain something from our presentation. We realize we just barely scratched the surface, and we currently have people waiting at the door to get in their conference room. But thank you so much for logging on and attending. And Carly, do you have any?
Yes, I just want to thank everyone, and I would like to say that if CLL Society can forward the remaining questions to us, we will try to answer, and then you guys could disseminate them. I don't know. We feel badly for having what seemed like a short amount of time. Thank you so much, everybody.
And I guess this ends the webinar. Thanks, everybody, for attending.